There is an internationally accepted definition, which is an incidence of less than 6 in 100,000. And to give some context, there are also less common cancers, which are between 6 to 12. And then also the more common cancers like prostate, breast, colon, lung that you're familiar with, which are greater than 12 in 100,000. And the thing about the rare cancers is they've been neglected really, and they're actually called rare and neglected cancers because there are more than 180 of them, and individually they don't amount to much, but together they do. And that's really the point here, is why do we really need to worry about it? And it's because their incidence is about a quarter of all cancers, but the death rate is much higher, it's about 40%. And the other thing is brain cancers, and this interestingly uses another sort of a treatment approach called CAR T cells that people may have heard about. And it's somewhat similar to the previous one because you'll see sticking out of this T cell is actually a genetically engineered molecule. And that molecule has a fragment of an antibody that I showed in the antibody drug conjugate, but this time it signals back into the T cell. So if it binds, tells the T cell, we've hit the target, you need to actually go and make some things that might kill the target. And so these T cells, they wander all around your body, they can wander into tumours, and then they can target the cancer cell, get activated, and when they do, they spill their guts basically against the cancer cell and kill it. And then you've got a perforated cancer cell, and then the T cell, once it's done that job, actually leaves and it goes looking for another one. So people have used the term serial killer. So if they're good, that's the sort of work they'll do, and they're the sort of T cells we want to make. So we've got a program to do that, not only locally, but in collaboration with the Sydney Children's Hospital. So thank you.
Thanks very much, Michael. That was fascinating. Perhaps just for those who aren't familiar with what a T cell is, that's an immunological cell, so it's part of our natural system that fights against infections and diseases, just to clarify. But one of the things that occurred to me as you were speaking is that traditionally the pharmaceutical companies want to make a drug that they can sell the same drug to millions of people and make lots of money, and that's nothing wrong with that. As we get into these more specialised and perhaps even individualised treatments, how is that actually going to work practically to get it out? If you have to make a new drug for every person, how's it going to work?
Well, it's already happening in this country. So CAR T cell therapy is available for children, young adults under 25 who have B-cell leukemia that is not responsive to standard treatment. And the federal government has actually invested in a manufacturing centre at Peter MacCallum Cancer Institute in Melbourne. There will be other such products coming to the market for the more common lymphoma, B-cell lymphoma. The leukemia is relatively rare, the lymphoma is more common. And then it actually becomes a very serious question about equity of access. So I think we are working very hard in this state to provide that opportunity locally. Now, it may not be manufacturing, but it may actually be giving the treatment here. The cells can be made off-site. In fact, currently, if cells are made for patients to be infused later, they're done in a place called Morris Plains, New Jersey, which is where the Novartis facility is. There's only one facility in the world, there's another one in Europe. So they desperately need one in the Asia-Pacific region. But we do need to get up to speed and basically lift our game so that we can get this done here as well.
Yeah. And so, given what you've just described, I mean, for each individual treatment, it sounds expensive. Are you able to give us some sort of ballpark?
Horrendously expensive. So it probably costs, realistically, it's very interesting in the Australian model, $500,000 US to buy the drug. I don't know what, they may have negotiated a different price with Novartis. No one will know what Novartis is paying because then their competitors will know, so they can't tell them that. And then there will be the cost of putting them in hospital if they have side effects, and that could be upwards of $500,000. So it's enormously expensive treatment, but potentially curative.